Don't you remember when you went first to school? You went to kindergarten. And in kindergarten, the idea was to push along so that you could get into first grade, and then push along so that you could get into second grade, third grade, and so on, going up and up. And then you went to high school, and this was a great transition in life. And now the pressure is being put on. You must get ahead. You must go up the grades and finally be good enough to get to college. And then when you get to college, you're still going step by step, up to the great moment in which you're ready to go out into the world. And then when you get out into this famous world comes the struggle for success in profession or business. And again, there seems to be a ladder before you, something for which you're reaching all the time. And then, suddenly, when you're about 40 or 45 years old in the middle of life, you wake up one day and say, huh? I've arrived. And by Jove, I feel pretty much the same as I've always felt. In fact, I'm not so sure that I don't feel a little bit cheated. Because, you see, you were fooled. You were always living for somewhere where you aren't. And while...
That's the rat race, thinking you're going to get somewhere. Spin that wheel, baby. Round and round the wheel of fortune. What you gain on the roundabout, you lose on the swings. Now, what's the nature of the rat race?
Because we've simply cheated ourselves the whole way down the line. We thought of life by analogy with a journey, with a pilgrimage, which had a serious purpose at the end, and the thing was to get to that end, success or whatever it is, or maybe heaven after you're dead. But we missed the point the whole way along. It was a musical thing, and you were supposed to sing or to dance while the music was being played. But you had to do that thing. You didn't let it happen.
This pandemic has really allowed us to have the time to slow down and put things in perspective. It allowed us to have the time to reflect on our life's journey and the trajectory of this journey relative to our goals and our happiness, right? Because you see, happiness is, I think, what you and I and everyone else is striving for. But the thing with happiness is that it's very elusive, it's very slippery, right? You know, we are happy to see our Amazon package, arrive at our door, right? Excited to open and unbox our toy, our next gadget, our next Gucci shoes or slippers, our Louis Vuitton bags. But, within the next hour or the next day or the next couple of days, we are back to our old, depressed self again, searching for that next hit of dopamine that we call happiness, right? So now we're back scrolling online to find the next thing to buy. Now, I might not have the right answer to this human angst of addiction and dissatisfaction. But for me personally, trying to look for that small pockets of joy, such as going for a brisk walk, going for a run, seeing the sunset, playing tag with my daughter, being silly with my friends, you know, allows me to slow down the cravings and the games that the mind plays with us. I thoroughly believe that if we are not in control of our mind, our emotions, our cravings, then it has full control over us. Hello, hello, beautiful people. How's everybody doing today? I hope you guys are having a blessed day. So in this video, I just want to fairly and quickly go over ARDS, right? I just want to go over the important things that you do have to be mindful about on the NCLEX exam, because ARDS is a popular topic in that exam. And, obviously, we do need to know the difference between ARF, right, and ARDS. So ARDS, it's an acute respiratory distress syndrome, right? It's also called a shock lung or a white lung, right? It's a state of respiratory failure in which, the fluid, there's going to be fluid that's being collected in the air sacs, therefore depriving, the organs of oxygen, right? So it's also called a non-cardiac pulmonary edema, okay? Now, the main characteristic that you do have to know in regards with ARDS is that the partial pressure of oxygen in patients with ARDS is less than 60 millimeters of mercury, right? Less than 60 mmHg, right? And also, there can be some abnormal ABGs, obviously. The patient can have excess carbon dioxide in the blood, right, in the bloodstream, which is what we call hypercapnia, right? So excess of CO2 in the bloodstream. And then we're also looking at decrease of oxygenation, which is obviously hypoxemia, right? So when we assess our patients, we're looking at, the positive feedback. Therefore, the patient will be tachycardic, right, to reinforce the decrease of oxygenation in the tissues and in the bloodstream. We would see cyanosis, so the patient will be cyanotic. So as I mentioned before, a patient could also have hyperpnea, hypotension, and the patient would be diaphoretic, right? So there's going to be some diminished breath sounds, and there's going to be some refractory hypoxemia in the patient, okay? Now, again, when we have tachycardia and we have tachypnea, that indicates hypoxemia. So basically, we're looking at, depriving our organs of oxygenation. So it is an emergency, right? Interventions that we could, for these patients, is usually mechanical ventilation and endotracheal intubation. Right. Now, when we're looking at mechanical ventilators, usually we're looking at a few types, such as the positive negative pressure ventilators. There's also the volume cycle ventilators, and also there's the pressure cycled ventilators, which is basically both negative and positive pressure ventilation, right? So our job is to maintain endotracheal intubation, mechanical intubation with PEEP, right, or positive and expiratory pressure, or with a CPAP, which is, a continuous positive airway pressure, right? And basically all of this, the goal is to basically maintain a partial pressure oxygenation of greater than 60 millimeters of mercury, right? That's the goal, having 60 mmHg, or having the patient an O2 saturation level of greater than 90%. Okay, so basically we're looking at, making sure that the O2 saturation levels are within, hopefully above 90%, right? That's what we're hoping. Now, regards with drug treatment, obviously bronchodilators, right? We can get albuterol. We can also, as prescribed by the physician, we can also give anticoagulants such as heparin, enoxaparin, which is Lovenox, and warfarin, which is Coumadin. Okay. Now, for steroids, we're looking at hydrocortisone and methylprednisone. Those are the two most common steroids that is prescribed for a patient with ARDS, right? Obviously, we could also give analgesics and some diuretics, such as furosemide, which is Lasix, right? And that's if there's fluid overload is the cause, okay? So again, I just want to fairly quickly go over ARDS with you guys. I know it's going to be an important topic for your NCLEX exam. I and I will be going back again to having, my notes being on the screen. But for now, I just want to briefly go over this topic. And so I hope you guys have a blessed day. I will talk to you later.